Welcome to UMCC Medical Consultant Connector, where your health matters to us. Ever wondered how a mere sip of water can land you in a life-threatening situation? Imagine a disease so sneaky, it lurks in the most basic element of life, water. We're talking about cholera here, a severe diarrheal disease that can turn deadly within hours if not treated. It's a grim reality for many, and yet it's a topic that's often overlooked. Yes, today we're diving into the world of cholera, a seemingly simple but deadly disease. So, what's behind this devastating condition? The answer is smaller than you might think. It's a bacterium known as Vibrio cholerae. This microscopic organism is the invisible culprit behind the notorious illness cholera. Vibrio cholerae is a shapeshifter, able to survive in both aquatic environments and the human body. When it enters the human body, usually through contaminated water or food, it releases a toxin that causes the cells lining your intestines to release increased amounts of water. This results in severe diarrhea, which can lead to dangerous levels of dehydration if not treated promptly. It's hard to believe that something so small can cause such a significant health crisis, isn't it? But that's the power of bacteria. They're tiny, but when they invade our bodies in large numbers, they can wreak havoc on our health. And so our invisible enemy in the battle against cholera is this, Vibrio cholerae. That's right, a tiny bacterium is all it takes to set off this health crisis. How can you tell if it's cholera knocking at your door? Well, it's essential to recognize the telltale signs of this invisible adversary. Cholera often announces its arrival with a sudden onset of severe diarrhea, which can be rice-watery or even slightly cloudy. This is usually accompanied by vomiting as the body tries to rid itself of the invading bacteria, but the symptoms don't stop there. As the body loses fluids rapidly, it can cause a rapid heart rate, a sign that your body is working overtime to compensate for the loss of fluids. You might also notice a loss of skin elasticity, a sign of severe dehydration. Then there are other symptoms like low blood pressure and muscle cramps. These too are a result of your body losing essential electrolytes in the process of battling this disease. It's a rapid onset, and these symptoms can start as early as a few hours after exposure. Is it cholera or just an upset stomach? How do doctors tell the difference? This is where the science of diagnosis comes into play. Doctors use several methods to confirm a case of cholera. One of the most common is a stool sample test. The sample is examined in a lab where experts look for the presence of the Vibrio cholerae bacteria, the microscopic troublemaker responsible for this disease. But what if we need to confirm the diagnosis quickly, perhaps in an area with limited lab facilities? That's where rapid dipstick tests come in handy. These tests react to the presence of the cholera bacteria in a stool sample, providing results within just a few hours. They may not be as precise as lab tests, but in a pinch, they can be a lifesaver. And remember, early detection is key. It's a quick process, but early diagnosis is crucial for effective treatment. So, if you're feeling under the weather, don't hesitate to seek medical help. Cholera sounds terrifying, but how can we protect ourselves and treat it if necessary? The first line of defense is prevention. This includes maintaining good hygiene practices. Washing your hands regularly, especially before meals and after using the restroom, can significantly reduce the risk of infection. Safe food practices are also crucial. Ensure that your food is well cooked and safe to consume. Be cautious with seafood, as it can often be a carrier of the bacteria. Drinking safe water is equally important. If you're unsure about the safety of your water source, boiling it can help eliminate any cholera bacteria present. But what if prevention fails and you find yourself or someone else affected? The primary treatment for cholera is rehydration. In severe cases, intravenous fluids may be necessary. Antibiotics can also help reduce the duration of the illness, and zinc supplements can be beneficial for children. Remember, prevention is always better than cure. Stay safe, stay informed. Let's quickly revisit what we've learned about cholera. This infectious disease is caused by the Vibrio cholerae bacteria, which can bring about severe dehydration through relentless diarrhea. Its symptoms are easily recognizable: rapid heart rate, loss of skin elasticity, and low blood pressure, to name a few. Diagnosis is typically confirmed through a stool test. Prevention is largely about clean water and food, and treatment involves rehydration and antibiotics. Knowledge is power. Keep yours updated and stay one step ahead of cholera. UMCC, your ultimate medical consultants connector.